Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health. Thought I'd take the opportunity, perhaps last gasps of beautiful fall weather, to really be outside, enjoy the outdoors. No need for masks when you're out in the outdoors. It's really a great opportunity to get some exercise, appreciate the wonderful experiences that we have around here. In terms of things to think about as we move into the winter. So one of the first things, we're seeing a rise in cases. We're not exactly sure why that's happening, but potentially it's part of the things that move us inside because of the colder weather. Also the opening up. We've seen a lot of places that have opened up, and one of the highest risk things that happens is you move indoors, and that's great if you're wearing a mask and you keep wearing a face covering. But what happens if you need to remove it? If you're eating, for example. So one of the things that's happening in restaurants and certainly at bars where we're eating and drinking, we have to take the mask off to be able to do that. And that essentially increases the risk of exposure. So that may be one of the reasons with the indoor aspects to this. The other thing that I think is going to start to play a part in this is we're learning more about the contact tracing, and having done the contact tracing course and experienced this in a number of personal experiences of contact tracing for friends and family, we've really sort of focused on the previous 2 days, and there's really a general consensus to move to this sort of expanded contact tracing because the activity of this virus is such that it has a tendency to be linked to certain individuals, and we call these super spreading events. We're not entirely sure exactly what's going on. Are these single individuals? Is it individuals at a certain time perhaps because they're at the peak of their infectivity, maybe without symptoms or perhaps mild symptoms, so they're not really aware, and that causes the big release of virus particles that's causing these super spreading events. But as we learn more, one of the things that is clear about contact tracing, and we've seen this in a number of municipalities, in states and so forth, where the health department is unable to cope with the numbers of contact tracing that's required, and they devolve that down to businesses. So when you think about that from your perspective, if you're going to reopen, you have to be equipped in some cases to be able to contact trace. How do you approach that? In many instances, what I've seen is it's a paper-based process, or indeed a spreadsheet-based process. And spreadsheets better than paper for some reasons, but it's still not good enough. What we need is a good database, a good process, and a good approach to this. And we need to go forwards and backwards. So what happens, and finding the origin or the source of this, I think is going to be essential. How do you do that? Well, I think you need help and advice. This is just not something that you can go out and do. You can't just allocate somebody, have them do the course, and then say, right, you're the contact tracer. There is so much involved in this that it really requires expertise that gives you insights into the process, and it's for the benefit of the business, not just the general community, but in terms of preventing spread of infection and closing down your business perhaps for the second, maybe even the third time, and perhaps that's something that would cause you to close forever. You want to get this right, you need help, and that's one of the things that we've certainly been doing with some of our clients. And then finally, another interesting area that I think relates to this is using artificial intelligence, machine learning, and video to detect mask compliance. And this is not the pejorative version of this. To be clear, this is not about tagging people and then going and issuing edicts and tracing them down. This is about first of all, feedback at the time. What I found in many instances, not all cases, but certainly in some instances where you remind people, they forget. It's easy to forget. This has just not been part of our routine, although it's increasing. I can't tell you the number of times I still go out of the house and forget to take my face covering. That's why we've got them in the car now, which gosh, wouldn't have had that 7 or 8 months ago. But if you forget, having somebody remind you. But imagine having technology exactly the same as you find on the highways, motorways, where you have a sign that flashes and says, gosh, you're going over the 70-mile-an-hour limit. It flashes red. And what you find is the traffic slows down. So it's actually an effective feedback mechanism. But the other thing that's interesting about this is it can be one of your metrics as part of the dashboard that you have as a college, as a business, that says, here's how we're doing. Surveying a specific area, perhaps the entrance. What is the compliance of your visitors, your employees, your delivery? What is the compliance level of masking on those people on an hourly basis, on a daily basis? That's actually relevant. And if you're seeing it fall, what's happening? Can you do anything to change the behavior? These are all great metrics. Whilst we're still looking for treatments, we have to find other ways to suppress this virus. We can't sustain this economic impact of, full closure. We have to find safe ways of opening. It is possible, but what's key to this is finding tools and techniques that work and receiving good expertise advice. And that's one of the things that we can do for you. Please reach out to me. You'll find the link below. There's capabilities. We can certainly advise you. We'd love to at least get on the phone and talk to you about some of these things and help you get it right first time. This is Dr. Nick. I'm the Incrementalist, here with incremental insights for better business, better health.